Now, concerns around vaccine hesitancy, just one of the reasons that the vaccine rollout seems to have stalled. Just 4 million people have now been vaccinated against COVID-19 so far, representing just 10.5% of our population. We're joined now by Professor Thumbi Ndung'u, the Deputy Director of the African Health Research Institute. Professor Ndung'u, good evening to you. Thank you very much indeed for your time. Is this a problem only in South Africa, or are we seeing it in other countries as well? It really gets to the heart of why people may not be getting vaccinations.
Well, thanks for having me on the show. I think vaccine hesitancy and hostility is a problem that we see the world over. In fact, a survey from 2018, a global survey that was done by the Wellcome Trust showed that vaccine hesitancy was lowest in Africa, incidentally. So this idea of vaccine hesitancy is not just a South African problem. It's certainly a global problem. And in Africa, it has just been exacerbated actually by the current pandemic. In fact, the survey that I'm referring to that was done in 2018 showed that more than 75% of Africans had trust in vaccines. And that number seems to obviously to have gone down rather in terms of the people who trust vaccines. But I think that's probably as a result of social media and global engagement, particularly that we see now with the current pandemic.
There are probably several things at play here. On the one side, there's sort of people who just refuse to get vaccines. From what I understand, there's surveys by the University of Johannesburg. That number is actually relatively low, despite the attention that they get, and I understand that. But then the other problem is, and this may be a bigger problem for us at the moment in terms of numbers, people who don't mind getting a vaccine, perfectly happy to get one. It's not convenient, and I don't just mean it's going to take time out of a Saturday. I mean, it's either go and get a vaccine or pay money for a taxi, which you would rather spend on a loaf of bread to get you through the day. Is that perhaps a bigger problem? There just aren't enough vaccination sites in the right places at the moment.
Yeah, I would agree that the main problem that we are facing actually in Africa is access rather than vaccine hostility. If you think about it, in Africa we have very low numbers of vaccinated people, and that's not because people are refusing to be vaccinated. In fact, what we see in Africa is that a lot of people are willing to line up to be vaccinated. But of course, we are in a low resource setting, and so the ability of people to get, first of all, to access the vaccine, the ability of governments to access the vaccines is low. But even when governments have been able to access those vaccines, the ability to distribute those vaccines to the people that need them, to every corner of the country has been difficult. And as you say, the resources for people to be able to go to vaccination centers, for example, to get these vaccines is a problem. So I think that in Africa, in fact, we shouldn't really be dwelling too much on the issue of vaccine hostility, although I think that we should be doing something about that so that it doesn't become a problem. It is more a question of access to vaccines rather than hostility to the vaccines that is that has slowed us down in terms of coverage.
I mean, many countries across our continent are able to hold elections on a regular basis, and most of those elections involve polling stations very, very close to local communities. And I mean, I know, for example, that in our country, the IEC was asked, where would you put vaccination sites? The IEC is our electoral commission. I mean, is that a place to start? Many countries, democracies, would be able to start there. People would know where you would actually put vaccination sites. The problem then simply becomes money and the doses of vaccines.
I think you're right. I think the priorities of African governments haven't always been right. I think we have underinvested in healthcare so that we are able to invest, for example, in running elections, even though they haven't always been effective in Africa. They haven't always been smoothly run, but certainly it shows that with investment, it is possible. But I think it also shows that we have massively underinvested in healthcare delivery. I think delivering something like a vaccine takes certain different logistical implications to delivering an election, because an election, for example, is a once-off affair, whereas delivering vaccines and doing so reliably over a long period of time, because this is what we want to do, might mean installing new infrastructure, such as, for example, freezers to keep these vaccines, electricity in order to keep the vaccines cool over a short period of time and be able to deliver them. And of course, healthcare workers who are well trained who can deliver these vaccines. And I think that we are lacking in these kinds of infrastructure that is, long-term infrastructure over a long period of time, as opposed to, for example, delivering an election. So I think it's a lesson for all of us that we need to rethink about reinvesting in Africa. If you look at the amount of money, the GDP, the percentage of the GDP that is invested in health in sub-Saharan Africa, I don't think it is fit for purpose. And this pandemic teaches us that we need to rethink our priorities.
Professor Thumbi Ndung'u, do appreciate the time tonight. Thanks very much indeed.